My name's Cindy Balliette. I'm the Navigator Program Specialist here at Community Action, and I'd like to just give you some information, a little bit of orientation about the process that we go through while you're here to see if you may be eligible for some of the assistance through the Affordable Care Act. Way back in 2010, the Affordable Care Act was made a law. At that time, there were 25,000 pages in the actual law itself. There was a lot of information about health care reform. What was significant about that reform and those changes have really come into play just really very, very powerfully this year in 2014. The first is what we call the individual mandate, basically stating that you're required to have health insurance or be signed up with a plan by March 2014, or excuse me, by March 31st, 2014, or essentially you would pay a penalty. And that penalty would be based on your income. It would be either $95 or 1% of your income. Now, there are people that do not qualify, that may be called what we call exempt, or they may get an exception to the mandate based on their income levels. If their income levels are too low, then they do not qualify for assistance through the Affordable Care Act and therefore will not pay a penalty. The level that is required in order to meet that threshold or that baseline where assistance will be provided is called the federal poverty level. So assistance is available for those people that that earn over 100% of the federal poverty level all the way up to 400% of the federal poverty level. So obviously, as the farther away you go from the 100 percentile, the less assistance you will receive. If you fall between 100 and 250% of that federal poverty level, then you will essentially receive what is called a cost share reduction. A cost share reduction basically means that you will notice a definite decrease in things like your deductible, your out-of-pocket max, and your coinsurance. Along with the basic assistance that's provided are the plans themselves. The plans that are offered through the marketplace, which is essentially a location or a website that is governed by the agency that runs it, is called CMS, Centers for Medicare and Medicaid Services. They are offering premium tax credits to help those people who qualify pay a portion of their premium to make it affordable. Those plans themselves are including 10 essential health benefits. Those benefits include outpatient services, your hospital and your doctor's visits, includes emergency, hospitalization, maternity and newborn care, and I just might add, all these plans are unisex policies. The only thing that they will ask you while you're applying is if you are a smoker, and your zip code and your date of birth to determine the premium. Unfortunately, if you smoke, the premium can be rated up to 50% of the premium price. The other benefits that are included, health benefits, are mental health and substance use disorder services, prescription drug plans included, rehab and habilitative services, labs are included, preventive and wellness services, and chronic disease management. You will see several different screenings that are available to you at no cost each year. Each plan has to have that when you find it on the marketplace. Talk a little bit about the deadlines. Right now we have approximately 2 more weeks and counting to the end of open enrollment. That's March 31st, 2014. There are a couple ways to enroll. You can certainly enroll through the navigator such as myself, or there is the 1-800 number. That's 1-800-318-2596. It's a call center. They'll take all your information. There's also, you can also enroll at healthcare.gov online. It's a very fast way. What you have to remember is you have to estimate your income. That's probably the biggest challenge. people have to predict, what am I going to make for the year 2014. This is the year it started, so you have to estimate from January 1st all the way to the end of December 31st what you think your estimated income would be. And that figure is what we call the modified adjusted gross. It's basically line 37 from your taxes. So it's before taxes are taken out. If you do receive unemployment or any type of Social Security benefit, those are added back in. That's what we consider the modified adjusted gross portion, or excuse me, the modified portion of the calculation. So the process itself to apply is really quite simple. I'm going to direct you to a subsidy calculator just to give you an estimate of how much money the government will assist you with. So basically we go to a website called kff.org, and that's managed by the Kaiser Family Foundation, and you'll just enter some very simple numbers in there to basically see what you would qualify for. You'll put your zip code, your projected income for 2014, how many people are in the household, and how many people are applying for coverage, and they also will ask you if you smoke. And then you'll just hit submit, and instantly that particular website will tell you what you're qualified for in terms of an estimate, in terms of how much the government will help pay your portion of a premium. Let's make it easy. Let's say your $5,000, your estimate is you're going to make $15,000 a year, and you're a 47-year-old woman living in zip code 48506. And basically it's going to tell you that you qualify for perhaps $4,500 worth of subsidy, while the premium is going to cost $5,000. So in essence, your portion that you would pay would be $500 divided by 12, which is roughly a little bit over $40 each month. And that would be at the silver plan. There are 4 levels of plans, and basically the first level is the cost share would be a 60-40 split, meaning the insurance company pays 60%, you're responsible for 40, that's bronze. The next level is silver, that's 70-30 cost share, gold is 80-20, and platinum is 90-10. The cost share reductions I talked about, where they reduce deductibles, coinsurance, and out-of-pocket max, are only available at the silver level. The process itself is pretty simple. We'll just go to healthcare.gov. We'll create an account. We have to open an email address, and we send a message to that email, and then basically we have to come up with a username and password, and then we apply. There are 4 agencies involved, 3 of them federal. They include the IRS, the Internal Revenue Service, Social Security, and Homeland Security. And there'll also be a consumer reporting agency that's going to ask you individual questions to verify your identity. So you'll apply, you'll give them your information, you have to file an income tax return, and basically you'll go through the process and hopefully eligibility will come up. And then after eligibility, you go to the plans. There are only 4 companies that you'll see that are offering coverage through the marketplace, which is the government's website that offers the tax credits. Those companies are Blue Cross and Blue Shield in Nebraska, Coventry, Health Alliance Midwest, and Co-Opportunity. And then after the plans come up, the next step would be just to enroll. You can enroll online, or you can wait, you can do a little bit of research, and you can log back in and essentially enroll online, or you could call the marketplace and do so, or if you get a chance, you can certainly enroll with us here at Community Action.